Let's take some time to learn about learning. There are a variety of different kinds of learning. We will talk about the ones which are most important to understand for fear-free care. Classical conditioning links emotional responses or other involuntary responses, such as secretions and reflexes, with a stimulus over time through predictions. Classical conditioning can happen rapidly, or it can take time to develop. When a dog sees a pair of nail trimmers for the first time, she likely shows no fear of this small piece of plastic and metal. However, when the appearance of the nail trimmers begins to predict a wrestling match over nail clipping, the animal may develop a classically conditioned response. Over time, she may run and hide, or show other signs of FAS simply at the sight of the nail clippers alone. The nail clippers alone start the emotional cascade the animal experiences during wrestling for nail trimming, without anyone reaching for a single paw because of the predictive relationship that formed. Nail clippers predict unpleasant experiences. Classically conditioned responses can be very intense, and they are always outside the learner's control. Desensitization is the process of teaching the learner that a specific stimulus is non-threatening over time through repeated, controlled, gentle exposures. With desensitization, the intensity of the trigger stimulus is carefully controlled, and the animal is closely watched to assure no visible signs of FAS occur when the stimulus is presented. It is crucial that a non-stressful starting point is identified, and the learner dictates the pace at which the stimulus intensity can be increased. The intensity of the stimulus can be controlled a number of ways, including the distance between the stimulus and the animal, the duration of time the stimulus is presented, sound volume for noises, firmness of touching for tactile concerns, and others. Desensitization combined with classical conditioning is a great way to approach most treatments because it can help prevent animals from learning to fear veterinary care. Classical counterconditioning uses predictions to replace unwanted emotional responses with more favorable ones. Because it is a form of classical conditioning, remember that the learner does not consciously control his reactions. Classical counterconditioning is generally used along with desensitization to encourage animals to like something they have previously feared. To prevent the development of FAS with a procedure, desensitization and classical conditioning can be used proactively, thus creating a positive emotional response to procedures and handling from the start, rather than a neutral or negative association. Desensitization and classical counterconditioning are used as an intervention technique when an existing negative emotional response already exists, and we're trying to change the pet's response to a positive emotional response. Desensitization and classical conditioning, or classical counterconditioning, can take a few minutes or a few visits, depending upon the severity of the patient's FAS, the skill level of the person using the technique, and the complexity of the treatment the patient is being taught to enjoy. Desensitization and classical counterconditioning are a cornerstone of providing advanced, fear-free care. These techniques will work with all species. The process is simple and effective, as long as we pay good attention to the learner's signals and frequently assess ourselves and the patient through the process. The first step is to identify the potential trigger stimulus. Several examples will be discussed in detail later in the module. The second step is to identify something that elicits the desired happy emotional response, such as treats, toys, or happy praise. We want the animal to see the item and think, "This is awesome." Visible signs of a positive emotional state should be observed. The next step is to break down the trigger into many small baby steps for the purpose of controlled exposures through desensitization. This set of steps is often called an exposure hierarchy or exposure ladder, and detailed ladders will be provided as examples later in this module. Once the trigger stimulus is identified and broken down into numerous tiny controlled exposures, the pairing begins. The starting point should not elicit a visible or observable response from the learner. Every small exposure should predict something wonderful, thus eliciting a positive emotional response. Assess the learner's response to the low-level trigger, followed by the "This is awesome" stimulus. Visible signs of positive emotional response are the goal. During each exposure, monitor the learner for signs of FAS, and if FAS increases, the exposure level was too intense for the current time. Return to a non-stressful starting point and add more rungs to the exposure ladder, further breaking down the stimulus into more baby steps. Before we begin making a plan for desensitization and classical counterconditioning, it is important to recognize the role of treats. You will see many high-value treats mentioned and used in the videos for this module. The use of high-value food gives us a good opportunity to create the desired emotional response. In some cases, high-value foods can mask FAS in patients. For this reason, it is important to note whether the animal is accepting food and how the animal is accepting the food. The animal's body should be reasonably relaxed. If the animal becomes more tense, begins taking food with a hard mouth, begins snatching the food and then retreating, reassess the situation. Make sure the animal is truly comfortable with the approximation before moving forward. Here is a human analogy to help illustrate the issue with very high value rewards, sometimes masking FAS. You're afraid of spiders. I ask you to touch a cage containing a tarantula for $5. You say no. I increase my offer to $20, $50, or $100. Finally, when I get to $500, you agree to touch the tarantula cage. It is easy to imagine what that touch looks like. Your hand shoots out like a striking snake and brushes the cage. You swipe the $500 and take off, flooded with adrenaline. In this example, are you any less fearful of spiders? No, but the appeal of the reward was strong enough to coax you to endure the fear for the briefest possible moment in order to get the money. Because the goal is reducing fear, rather than getting the touch, it is crucial to make sure the animal appears comfortable and relaxed while accepting the food, toy, or other awesome item. Creating an exposure ladder depends upon the patient's level of FAS, the complexity of the procedure, and individual variation. Desensitization and classical conditioning can be used preventatively, while desensitization and classical counterconditioning is used as an intervention when a fear response has already been established. Approaching most procedures with the principles of desensitization and classical conditioning in mind is a very effective preventive strategy. Preventing fear is easier than reversing it. Different patients will require different numbers of rungs on the ladder. In general, patients with less fear will be able to tolerate a more rapid desensitization and classical conditioning process, while patients who are more fearful will require more rungs on the exposure ladder for desensitization and classical counterconditioning. In some cases, the ladder will have so many rungs it appears as a ramp or bridge rather than a ladder. As you're going through the process of desensitization and classical counterconditioning, sometimes you will run into small problems. What if the animal shows increasing levels of FAS? Stop, assess yourself and the animal, and return to a non-stressful starting point before trying again. What if the animal won't take food, toys, or touch? This is one way the animal can communicate to us that he is not ready for desensitization and classical counterconditioning. The environment must be modified to be more comfortable or less threatening. The animal may be satiated, so food is not important. The animal may have had a negative experience with that particular type of food in the past, or medical treatment of FAS may be needed prior to further attempts at desensitization and counterconditioning. Remember that learning these techniques takes time and practice, and assessing yourself and the patient regularly will yield the desired result: long-term reduction in FAS. In the video, you will see a technician introducing the process of accepting ear medications to a patient. She uses the touch gradient and starts in a less sensitive area before gliding to the ear, and establishes a good response to touching of the ear before introducing liquids. You will notice at first that the dog shows some mild avoidance, shifting his head when his ear is lifted. The technicians remain at that level until the avoidance disappears before moving on. By introducing the process with a positive experience from the start, both the patient and the client are better prepared for continuing the treatment course at home.
There we go, good boy. There we go.
ears. Good. 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 Does avoid a little with his ears. They're sensitive. Good. 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 Good.